Hello everyone, welcome to our channel Mind Myth Momentous, that is M3. If you are new to this channel, please subscribe and hit the bell icon to get the regular notifications of all new uploads. In today's episode of the series Mental Health Matters, we will try to understand the topic stress, anxiety and depression. In present era, stress has become a part of human life. Hence, take it as a motivational force rather than a hindrance. More further, if you don't overcome it timely, it will overtake you throughout. Everyone experiences stress and anxiety at one time or another. Stress is a response to a threat in a situation, whereas anxiety is a reaction to the stress. On the surface, they both can look alike a lot, but there is a distinct differences. Anxiety, which has no clear cause, tends to last longer and be more difficult to treat. Let's see the differences between stress and anxiety. Number 1. Stress tends to be specific while anxiety is more diffuse. Number 2. Stress leads to mild emotional distress and in anxiety it's severe. Number 3. Stress can be managed by problem-solving techniques, whereas anxiety is perceived to be out of control of one's control. Number 4. During stress, one can maintain his or her normal routine. But in anxiety, the normal routine is hampered. Symptoms of stress can be categorized in 4 segments as physical, emotional, behavioral, and cognitive. Some of the physical stress symptoms are muscle tension, headache, sweating, dry mouth, back or neck pain, sleep disturbances, stomach problem, tiredness or fatigue, lack of energy, sexual problem, rapid breathing, etc. Emotional symptoms of stress can be fear, irritability, unhappiness, shame or guilt, boredom, no meaning to things, anger, worry, etc. Some of the symptoms for behavioral stress are avoidance, act impulsively, crying, drink or smoke too much, not responding, procrastinating, changing eating habits, blaming others or blaming the events or blaming self, etc. The fourth category for the symptoms of stress is cognitive. Some of the symptoms includes lack of concentration, difficulty in making decision, forgetfulness, preoccupation, loss of sense of humor, suicidal ideations, negative thinking, no clear plan or goal, self-criticism, confused, blaming, etc. etc. Most people think stress is all bad. However, there is bad stress and there is also good stress. Good stress can keep you focused and motivated to get the things done. For example, being stressed about giving a presentation can motivate you to prepare and rehearse. Bad stress is what you feel when you can't stop worrying about something and you feel overwhelmed all the time. This can cause stress overload. The warning signs of stress overload are getting angry easily, feeling tired and exhausted, cries easily and frequently over minor things, trouble sleeping either too much or too little, changes in appetite, either eating too much or eating too little, frequent headaches and upset stomach, moody and irritable, feeling depressed, withdrawing from family and friends, having trouble concentrating, acting out at school and at home, feeling pressured and overwhelmed, etc. etc. The stresses can be physical, emotional, social, etc. Stresses are things that cause stress, and anything to almost everything can be a stressor depending on an individual's perception and acceptance, like school for students, work, responsibilities, discriminations, family relationships, peer groups or friends, sickness, injury, fatigue, any major changes, etc. Some of the stresses are like workload, illness, that is of yours or of others, negative feedback, conflict, uncertainty, interruptions, deadlines, unclear expectations, money worries, others letting you down, family members' issues, conflicting priorities, lack of sleep, and so many. Stress typically goes away when the stressors disappear. However, chronic stress can escalate into anxiety or depression. So, it's important to take steps to reduce or eliminate stress whenever possible. If you are not sure whether you are suffering from stress, anxiety, or depression, don't delay in talking to a counselor, either at your school, workplace, or professional, or a healthcare provider to get the help you need. The earlier you take help, easier and faster you will heal. The journey to recovery begins with defining the cause of your issues and getting the right treatment. Is it anxiety or depression? If you often feel anxious or depressed for no apparent reasons, you may have an anxiety disorder, depression, or both. It's not unusual for someone to suffer from both conditions at the same time. In fact, just about half of those diagnosed with depression are also diagnosed with an anxiety disorder. Depression and anxiety are serious but treatable illnesses. It can be healed through therapies or medications or both. The same therapy or medications may be used to ease symptoms of each condition. The two also share similar symptoms like nervousness, irritability, insomnia, and problem concentrating, but each has its own cause. If you have an anxiety disorder, you may experience fear, panic, or anxiety in situations where most people won't feel anxious or threatened at all. A constant nagging worry or anxiousness can also be experienced. Sudden panic or anxiety attacks without any clear trigger. If left unattended or untreated, these disorders can affect one's work abilities, can limit to maintain relationship, or even leave the house. When you are depressed, it affects just about everything in your life. How you think, feel, behave, and function. You may experience one or more of these symptoms like discouragement, sadness, hopelessness, anger, lack of motivation or interest in life in general, low energy level, insomnia, feeling overwhelmed by daily tasks and personal interactions, etc. If these feelings last longer than 2 weeks and interfere with daily activities like spending time with friends, studying, caring for your family, or going to work, most likely you are experiencing a major depressive episode. Hence, needs immediate attention and remedials. We will find all about stress, anxiety, and depression and explore it positively in another series, that is SAD to Happy. SAD, S-A-D, means stress, anxiety, and depression. Happy, that is H-A-P-P-Y, means highly active with positive perception and you. That is SAD to Happy. Please don't forget to watch it to get the thorough insight and the possible solutions to all the concerns. See you there. Thanks for watching. Please like, comment, share, subscribe our channel Mind Myth Momentous, that is M3. Please don't forget to press the bell icon for notification of all the new uploads. Till then, bye.